even living in Long Island myself and driving past it a lot on Hempstead Turnpike, I really had no idea how good of a hospital that is. And people don't look at it that way because we are well known and renowned for the trauma services and the emergency department. But there's so much more to that hospital than just the emergency department. I mean, the ER itself, brand new, $38 million, state of the art. Has critical resuscitation rooms and surgery, operating rooms right in the emergency department, and it's manned by board certified ER doctors, so that if someone comes in, they're going to get the best of care in that emergency department. They're going to receive the top treatment, and then that's backed up by trauma specialists that we have in-house 24 hours a day. That can come down to the emergency department immediately to attend to victims of trauma. And these are top doctors, and I was shocked to learn they were trained at Harvard and Yale and some of the greatest, Columbia University, some really great schools. And we have one of our traumatologists is triple boarded, a thoracic surgeon, a trauma surgeon, and critical care. And we have such great doctors that come down to pick up where the ER doctor lets off and carry it right up to the operating room. 8 state-of-the-art operating rooms at National University Medical Center that the surgeons can work with, and then brand new intensive care units. Wow. So our surgical intensive care, our medical intensive care, and coronary care unit is brand new. Matter of fact, the CCU we haven't even cut the ribbon on yet, and that's how new these units are. So they're clean, they're airy, they're bright, they're manned by top board certified doctors, some of the best nurses in Nassau County, hard-working nurses that are there to take care of the patients. So, people don't really understand that we have these types of services available, and that's just on the emergency side, on the trauma side, on the surgical side. But we have just about all different specialties. We are well known for our burn center. So if there was a fire or, God forbid, someone has a horrible burn, they can be treated at our burn center. It's the largest in Long Island. It's a state-of-the-art burn center. We have our heliport where the aviation units are delivering patients to our hospital for these specialty services. We have a hyperbaric chamber, which is for patients that might have carbon monoxide or more commonly known for scuba divers when they get the bends. Right. But we have one that isn't, it's the largest. It can hold 6 people at once. Wow. Or if someone's critically ill, we put someone in there with a nurse and a doctor to attend to them while they're undergoing hyperbaric treatment. So it's the largest one in Long Island. It can hold 6 people, a multi-place hyperbaric chamber. And again, it brings a uniqueness to what we provide. We have other services, everything from cardiology. We are in collaboration with North Shore Long Island Jewish Hospital for cardiology, and they're providing a lot of the cardiology services for us. We have our cath lab opened up for diagnostic angiographies, and we're in the process of building out a PCI or a lab that we can do angioplasties and other types of procedures as well, and we're working towards that. So cardiology, we recently won a couple of awards from the American Heart Association for a gold award for heart failure for our treatment of patients with cardiac issues as well as stroke. And so we do have a designation of stroke center, so persons that are suffering from any types of symptoms related to a stroke, vertigo, nausea, headache, or weakness or paralysis, they are brought to our hospital. EMS notifies us of a potential stroke victim. We call a stroke code overhead, and immediately we clear the CAT scan table so it's ready for that patient when they walk in the door. Neurosurgery and neurologist are sent to the emergency department, as well as a neuroradiologist to read that CAT scan, specializing in strokes. So stroke, stroke victims, we're there for them. We have all the latest CAT scan. The CAT scan we have is one of the most advanced CAT scans, 320 slice, which actually is so powerful and so fast that it actually can take pictures of a beating heart and look at the coronary arteries to see if there's a blockage. Wow. So it's an amazing piece of equipment that we have available there, as well as actually 2 CAT scans, and we have MRI as well. So it's a full service hospital for cardiology and for neurosurgery, neurology, for strokes. Other services we provide, gastroenterology, we have full GI labs for both upper and lower endoscopies, colonoscopies or endoscopies to look for colon cancers or colon screening. And these are available to the public, to the residents of Nassau County, with a phone call. You know, they call the hospital, 476 NUMC, and you know, and make an appointment, and you come on in, get your visit, see the physician, get a cancer screening exam, whether it's for you know, stomach cancer or esophageal cancer or colon cancer. We can do that for them right away. Our radiology department, we mentioned briefly the CAT scan, MRI, but we have full echocardiogram for cardiology. We have a full nuclear stress test for cardiology, and we have, as a matter of fact, breast exams. We have a breast imaging center, which we have a large van, a bus that goes out to various community events to do screenings in the community, and we could do the screenings in the hospital as well. We have a beautifully designed separate area in the Department of Radiology just for mammograms and for women's health, so that they have a certain area. They come off the elevator, they go, you know, the women can go by themselves into a nicely really redone area, and have their mammograms or whatever else they might need in our Department of Radiology. So it's really, it really brings a lot to the table as far as preventive medicine, because we're all about preventive medicine.
Right.
You know, as a physician, it's one thing when you have a heart attack to prevent you from getting a second one or a second stroke or whatever it might be, but if we could prevent these things from happening first, that's where we should really put our energy to prevent that from happening. Whether it's going to primary care, doctors to measure cholesterol and your blood pressure and your diabetes and your sugar, it means so much in long-term health. Now, if we can keep your blood pressure under control, and we can do that, we can watch your blood pressure, we can put you on medication, keep that blood pressure within normal range so it doesn't cause a stroke or a heart attack. Watch your diabetes, watch what your glucose is doing, and control that with the proper medication or insulin pumps to give you, you know, give your body that extra chance of survival, to keep that sugar at a normal level. And there's so many other things that we could do at preventive medicine, whether it's for prostate cancer, colon cancer, breast cancer, screening for lesions on your skin, for melanomas and other types of dermatological problems. All these things in primary care medicine are so important. And to speak to that, we're now opening up, hopefully by March. It's under construction now, and I don't know if anybody's driven by NUMC on Hempstead Turnpike, and if you look in, you can see the whole first floor on the west side of the hospital is all under construction, and it's going to be a very large $17 million primary care center, and it's going to be beautiful state-of-the-art modern primary care, particularly for pediatrics, women's health and obstetrics and gynecology, and internal medicine and all the subspecialties. So you walk right in the front door of the hospital, there'll be a concierge greeter there, and you explain what you like, and they'll direct you right to the proper area, internal medicine, or OB/GYN, or pediatrics, and we can make an appointment for you right there and then, and register you to be seen. We also have a billing area there, so patients that have a problem with insurance or Medicaid or uninsured, we can help them get insurance if possible, or to work with them with their insurance company to get things done. So it's going to be a one-stop shop where someone who needs any type of these medical types of, you know, see any of these physicians, it's right there for them in our new primary care center. We also have 5 federally qualified healthcare centers out in the community that are seeing patients in various areas, Freeport and Oceanside and Elmont and Westbury, and and Hempstead. So these clinics are out there available for patients to see at any time. So there's so many things going on at NUMC that I could probably go on forever, and obviously I am going on forever talking about them, because I'm really excited about being the president there. I'm really excited about being associated with this hospital. There are so many very, very good things here, and there's so many things that people don't realize, and to get the word out, you know, we're not, you know, just Meadowbrook hospital anymore. We're a state-of-the-art hospital that has some of the greatest services of any hospital in Nassau County. And so for me to be put into this position as a physician, to see all of these things from my perspective, and to work with such great doctors, I really feel excited. I mean, it's you know, it's different as a physician to look at the management of the hospital. The finances are key, and in today's world, the hospital is a business, and a hospital has to learn how to survive, how to make money, and how to grow in the business sense. But yet, you can't just be focused on the business side. You can't just focus on the MBA aspects of running a hospital. Sure, it's important, and we're going to focus on those areas, but what a physician would look at, or what someone in healthcare would look at more is the patient, and what the patients need, how to bring patients into that hospital. Because that's what patients are coming for. They're not coming there to see the MBAs, not coming here to see the president or the CEO, they're coming to see a doctor and a nurse, and that's what we need to grow on. We need to make sure that the physicians are there, they're responsive and receptive to the patients, and the nursing care is the best. And I can honestly say that from my experience, that's what I'm seeing from our doctors. So we get the patients in, we treat them right, we give them the services that they require, and the business will build, the business will grow. There are expense side things that we need to look at, and we're trying to work together to cut a lot of the expenses, so that we'll be able to grow that hospital, but yet we need to grow a business. And things like our emergency department, our primary care site, our different types of mammographies and radiological services, our internal medicine subspecialties, such as cardiology, GI, nephrology, endocrine, allergies. I mean, we have all of these subspecialties in the hospital that are available for patients in the community to come and see. So we're just starting. I'm just breaking the surface of the Nassau University Medical Center. There's so many other things we could talk about, and I think we will. But I should maybe leave a second for you to ask a question, because you didn't give me the high sign to slow down, so I just kept talking.
We are here to listen to you, so it's fine. But I can see it really that your heart is here.
Thank you.
I can really see that, like I have been living in this area for, good 30 plus years, and I've been watching Nassau, Healthcare Center, and I believe that you are the first MD, doctor, CEO that the hospital has, if I'm not wrong.
I don't know, back many years ago, there may have been another physician, but nothing recently.
Nothing recently, as far as I know. Right? And I do see that you made significant difference you just joined in February. And from February is, only a few months. And still you made significant difference. So it really, tells us about your leadership skills. See, having all these equipments and latest state of the art, that is great. That definitely helps a lot. But the morale of the people who work there, that's more important. Like, for example, why do I feel that I want to work for you? How do I say that, okay, if I see a leader that you have your heart in it, then I feel like, if I'm working for you, then I feel like, okay, I gotta do this. And I believe that that's what you bring in, and that's what I'm hearing from outside, that you do bring in that quality, leadership quality. All this thing that you just mentioned did not happen overnight, obviously,
Yes,
right?
absolutely.
I mean, it has a lot of hard work.
Yes, over many years. Yes, so there's been a lot of movement in that direction to bring that hospital into where we're at today. But you're true. I mean, every day there's hardworking people,
Right.
and what I always tell them is that they're so important. Everybody's so important.
Right.
When you come to the hospital, you expect the medical care and nursing care to be the best.
Right.
That's sort of like one of the Gimme's automatics, that the physicians and the nurses are going to be excellent. But I stay, every morning at 7 a.m. I meet in housekeeping, and have my first cup of coffee with all the housekeepers as they come on duty, and I ask them, how are things? What do we need to do? What do you guys, what are you finding out? Let me know what needs to be done, and they're more than candid, and I've never seen the place looking cleaner. I mean, that floor is, it's immaculate. They really are keeping the place cleaner than any hospital I've ever seen. And they even let me drive that truck that waxes the floor up and down the hall once in a while, so I'm good for that.
So does that, is this like something that your law enforcement background has helped you in this?
Well, yeah, I guess so. I mean, when you're a police officer, you're actually in the community.
Exactly.
And, you know, your success basically hinges on how you deal with people.
Right.
And how you recognize people's feelings and
Right.
needs and
Right.
open yourself up to them.
Right.
So that you can hear both sides of the story. So, you know, when you're a police officer, you have to be able to talk to people and, you know, rationally and calmly try to, you know, calm the situation down and talk with people to find out what happened. Well, I mean, that helps, but I think it's just being a physician as well. Because if you think what a doctor does is a
Right.
doctor sits there and, you know, gives you dedicated time, just, you know, full concentration to exactly what you're concerned about or what your concerns are. And so the two of them together sort of go hand in hand. But they're doing a great job. I mean, I eat in the cafeteria every day. I have lunch there myself, and I eat what the patients eat, and the food is delicious. And you know, I go there and I'll have a breakfast, and I'll have eggs and whatever they're making, and then for lunch I'll have a sandwich, and I'll drink the coffee from there, and the coffee's delicious. So, I mean, that's what people care about when they come to the
Exactly,
hospital. I mean, they know the medicine is gonna be good. We're gonna have the best MRIs, the best
Right.
surgeons, the
Right.
best intensive care unit. But
Right.
what's what's mom's room like? Is mom's room immaculately clean?
Right.
How's the TV work? How's the food that she's eating?
Right.
You know, does she have enough pillows? You know, these hospitality
Right.
pieces of healthcare are very, very, very important. We're not taking anything away from the healthcare and the doctors and the nurses and the testing, everything that needs to be done for that patient has to be the finest and the best. But we need to take care of all the other aspects of their stay at the hospital as well, because no one really wants to be there.
Right.
It's not a very pleasant experience, unless you're on my third floor in my labor and delivery, because that's a happy place. And, you know, we just redid the whole labor and delivery
Okay.
area, and it is amazing. If anyone is pregnant, they really have to take a look at this place.
Okay.
Because if they look at the third floor at my labor and delivery, it's
Uh-huh.
18,000 square feet,
Uh-huh.
brand new, you think you're in one of the finest hotels.
Oh, yeah?
The rooms look like a fine hotel room, and then the walls spin around and
Wow.
drawers open up to reveal all the medical equipment. So
Uh-huh.
the bathrooms are even like fancy tiled mirrored bathrooms with showers. And then, you know, you come in there when you're in labor, and that's where you stay, and then as you deliver in that room as well. So it's a full LDR, labor delivery room, in that one, so you don't leave there, go to another room. The walls just spin around and you reveal the oxygen and the monitors and all the other stuff. And lights come down out of the ceiling on remote control. It's pretty cool.
Wow, interesting.
So that's our labor and delivery area, which we deliver little babies. We have a beautiful nursery, and sometimes whenever you're depressed or you're overworking, or you have your mind is on dish rip and 400 other things, you'll take a walk down to the nursery and just look at those babies, you know, just playing with their feet and stuff, and it cheers you up a little bit, you know?
Wow.
So it's nice. But we also have a NICU, a level 3 NICU, which it gives some comfort to the gynecologists and the obstetricians
Right.
that God forbid something should go wrong, that we have a neonatologist standing by, we have specialists, we have nurses standing by in a level 3 nursery. And our pediatrics is there as well upstairs, and we have a PICU, a pediatric intensive care unit, for some of the sicker children. So it's a full service pediatrics from labor to delivery to NICU, God forbid, and then if they have to come back in one time, to pediatrics or to the pediatric intensive care unit. So we have, you know, pediatricians in there, we have all sorts of pediatric specialists that are there, from pediatric allergists and endocrinologists to oncologists, just about all specialties in pediatrics that are available there. And people don't know that, I didn't know that, and I was working in the building. And
Wow.
every day I walk around, and I think one of the worst things they ever did was give me a set of pass keys to all the doors, and I just open up doors and walk in and see who's in there and say hello and find out what they're doing, and, you know, how to make that a better patient experience
Right.
when they arrive at the hospital.
Wow, wow. Very nice. We'll take a short break and we'll be right back.
Sure.
Please stay with us.